Now we're probably all a little tired of talking about cholesterol lowering drugs, so we got one more, but this one's a little different. This one is Fenofibrate, also known as Tricor, I believe is the way to pronounce it. So this is a fibrate. Fibrates treat and lower cholesterol and the fats in the blood. So specific MOA here is going to lower cholesterol, stops clogged arteries, and increase lipolysis. So lipolysis is the breakdown of fats in your body. It is caused by a receptor called PPAR alpha. I'm not going to go too in depth with that, but that is what it's caused, and that it deals a lot of the lowers triglycerides and increases that in your adipose tissue, so you're not having as much fat in your adipose tissue, if that makes sense. We're going to use this if you have high cholesterol, if you have hyperlipidemia. So this one is more focused on kind of a little bit more fat breakdown rather than just lowering cholesterol. Medical administration is through an oral tablet. Take it at the same time every day with or without food. Either is fine. Some complications: nausea, diarrhea, abdominal pain, headache, myopathy. So your myopathy is going to be your muscle pain, tenderness, and weakness, and in even severe cases, it can cause rhabdo. And hepatotoxicity. Precautions: if you have liver or gallbladder disease or renal impairment, you're going to want to probably not take this or really be precaution. It's not recommended in pregnancy or breastfeeding, or if you have any sort of hypersensitivity to other fibrates. Okay, back with Fenofibrate. We're going to first talk about some interactions. So other fibrates or statins are going to just increase those adverse effects, increase the risk of myopathy, which we do not want. Anticoagulants, I believe stuff like warfarin would be a good example. That's going to cause increase of bleeding, and we don't want that risk. And then we also have any other hypersensitivity to cyclosporine and then bile acid sequestrants, which that is going to reduce the absorption of that. As a nurse, we're going to assess the liver function and effects, including a lipid panel and then educating the patient, of course. And for patient education, we're going to be aware of the adverse effects, especially muscle pain, as that can get bad fast. We're going to maintain a healthy diet, exercise, and weight management if you're on this med. And lastly, to tell if this med is working, what it will do over time is lower the amount of total cholesterol, LDL, which is the bad cholesterol, and triglycerides, but it's also going to increase HDL.